Good morning and good afternoon and good evening to all PMNCH partners. Welcome to this Executive Committee webinar. We would like to suggest that all EC members have their videos on, and we can also then facilitate. So please, we will start now, and I would like to then just introduce myself for especially the new PMNCH members. My name is Helga Foxted. I'm the Executive Director of PMNCH. And we will now start the seminar, and we will start with a presentation from our board chair, Helen Clark. So maybe Elle, you can please then beam in Helen, please. Thank you.
Good morning, good afternoon, and good evening to everyone joining this webinar, where PMNCH is sharing its progress report for 1 January 2022 to 30 June this year, a report which outlines the key achievements over that period. So, over the next hour, you'll be hearing from the chairs of our standing committees and working groups, and from our executive director. This presentation serves as an abbreviated version of the full PMNCH Executive Committee Progress Report that's already been shared with the Executive Committee. And the committee will be asked to approve the full progress report following this webinar. Please note that for the webinar, the chat function is enabled, and please feel free to post any questions you have in the chat. Next slide, please. So here you will see the agenda and the flow of today's presentation. It begins by seeing key information on work planning and our budget and funding. Then there will be a briefing on the Global Forum for Adolescence and the 1.8 campaign. Then we move on to highlights on campaigns and outreach efforts in general, to partner engagement in countries, to governance, to knowledge products and accountability. And finally, there will be a summary of PMNCH's achievements by numbers and the Secretariat updates. And then there will be an ask articulated to the Executive Committee. So let me now hand over to Anne Stars, the co-chair of the PMNCH Strategic Advisory Committee. Anne is going to take you through the budget, work plan, funding, and results framework. Over to you, Anne.
Thank you, Helen, via video, and welcome to all of you who have joined the webinar. It's a pleasure for me to have this opportunity to share the great achievements and important work that PMNCH is doing, and much of which is thanks to all of you, the members who have pitched in and led the way and joined the path of PMNCH. So this complicated or dense slide demonstrates that the PMNCH work plan is based on 10 deliverables that are in 3 interrelated and mutually supportive functional areas. The first of these is what we call knowledge synthesis. So this is the work to synthesize data, trends, and evidence that for PMNCH partners can use in influencing and advocating for the implementation of existing commitments in the area of women's, children's, and adolescents' health, as well as mobilizing new ones. We also work on disseminating and making these resources available to partners. So that's the knowledge synthesis component. The second component is what we call partner engagement, which focuses on increasing the advocacy capacity and strengthening advocacy coalitions among PMNCH partners at the country, regional, and global levels. The aim of this is to create an effective voice on women's, children's, and adolescents' health for commitment implementation and mobilization. This includes support to what we call the Global Leaders Network, a coalition of heads of state and high-level representatives who speak out as champions on behalf of these issues, as well as ministerial, parliamentarian, civil society, and youth-led coalitions. The third component of the work plan is campaigns and outreach. This is where we deliver advocacy campaigns, events, media engagement, etc., to advance the commitments for women's, children's, and adolescents' health at the country, regional, and global levels. These 10 deliverables have all been approved by the PMNCH Executive Committee and the board. They were further developed at 2 retreats that PMNCH organized, one in February of 2022 and another one this year in February of 2023. They are coordinated by the Strategic Advocacy Committee, called SAC, which I co-chair with Gitinji Gitahi, the head of AMREF, and the Program Engagement for Countries Committee. PMNCH partners, led by the committees and the working groups, and facilitated by the PMNCH Secretariat, represented here by Helga and others, have been implementing this work plan with significant achievements, and we'll get to some of those later in this presentation. So very quickly, on the financial position of PMNCH, the Executive Committee has approved a framework budget for PMNCH of approximately $10 million per year. Over this 2022 to 2023 period, the financial planning reflects the prioritization that the EC made to focus PMNCH's efforts on the Global Forum for Adolescence, which has meant a somewhat lower spend in 2022 and a higher one for this year. As shown in the work plan budget, the actual expenditure, for example, was US $7.2 million in 2022, and we expect to spend about $12 million in 2023. So let's go to the next slide. So this summarizes the budget and shows that PMNCH secured a total funding of just under $21 million for this period. Given the expected expenditure level of just under 20 million, 19.2 million, this is therefore expected to represent an implementation rate of more than 90%. Some of the reserves will not be drawn on for this year and will be moved to the next biennium, the next 2-year period, to strengthen PMNCH's financial position for 2024-2025. And resource mobilization work continues to strengthen the budget basis for PMNCH's work. Okay, let's go to the next slide. So this slide summarizes the PMNCH results framework for 2021-2025, which has continued to evolve since the this current strategy was launched, and reflects changes in the broader environment that PMNCH operates in, and thus helps to ensure that the work of PMNCH is relevant and has an impact. So the logic of this framework is that the work plan, the PMNCH work plan deliverables, are reported as outputs, and these will be shown in the next slide, which these in turn contribute to a series of intermediate outcomes that we seek to achieve as an advocacy organization. For example, accelerating the implementation of existing commitments for women's, children's, and adolescents' health and well-being, and mobilizing new commitments where gaps exist. Implementation of these commitments in turn contribute to the higher level outcomes that are reflected in the results framework. They're shown here at the top, and those lead to impact, which is ultimately our efforts to reduce maternal, newborn, and child mortality and morbidity, to improve the sexual and reproductive health and rights of populations, and improve adolescent well-being. So the most recent work planning retreat in February 2023 contributed to further development of this results framework, which was also reviewed and discussed at the June 2023 board meeting. The PMNCH constituencies, the committees, and the working groups have all been engaged and consulted in the updating of this results framework. It will be updated soon with the actual target numbers once the executive committee approves the overall updated structure. So next slide shows the outputs related to the work plan deliverables, with the right-hand column focuses on metrics that result from PMNCH's efforts, as well as qualitative examples of results and specific case studies of impact. Okay, let's get to some slides that people might actually be able to read. Let's go to the next one. So this slide summarizes our work on the Global Forum for Adolescence, which supports the 1.8 billion campaign for young people, which is the flagship deliverable, as mentioned earlier, for the 2022-2023 work plan period. So the efforts to plan this began in 2022, guided by a set of principles, evidence, and tools that were convened and supported by PMNCH. This included the Meaningful Adolescent and Youth Engagement, MAYE, the Global Consensus Statement, and the Practical Guidance Resource for implementing this consensus statement. The Adolescent Wellbeing collection, a series of papers that were published in the BMJ, which included a letter signed by high-level champions, editorials, 4 opinion pieces, and 10 analytical articles. It also included the Adolescent Wellbeing Investment Case. Status report on this was submitted a few months ago in May of 2023. There are country case studies which are ongoing, and a global and national methodological toolkit, which is also ongoing. The work on the global AHA, which is the Accelerated Action for the Health of Adolescents, which is guidance that is intended to support country implementation on adolescent health, and this will be formally launched at the Global Forum for Adolescents in just a few weeks. We also have the What Young People Want, it's global survey, which has achieved well over 700,000 responses. This was even by the end of June. I'm not sure where the numbers are now, but probably somebody in the Secretariat can put it into the chat. We were aiming for 1 million total responses. We also have the adolescent wellbeing monitoring approach that was developed with the WHO and is helping to monitor, give us a set of tools and metrics for analyzing the progress and potential for adolescent health and well-being. Let's go to the next slide, which is more visual. We're getting away from the very tiny font. So this slide provides an overview, a sort of timeline of the different events that are leading up to the Global Forum on Adolescence. It started with a curtain raiser that launched the 1.8 billion Young People for Change campaign in October of 2022. And this shows the work through June 2023. And we're now, of course, picking up or are very close to the actual Global Forum on Adolescence. Any of you who follow PMNCH on Twitter, Instagram, etc., will have seen the great series of videos and tweets that are linked to this this campaign. Let's go to the next slide. So this summarizes the key results from the Global Forum for Adolescence and the 1.8 billion campaign as of June 2023 against the targets that were set. So you can see the target numbers there. And I won't spend time because we've got a lot of slides to go through, but I think it was one of the things I really appreciate about PMNCH. It can be hard to turn advocacy okay. Yes, yeah. I don't know. Somehow I got put on mute. It wasn't me, but I'm unmuted now. So just what I was saying is one of the things that I really appreciate about the PMNCH is this commitment to two metrics. I think I might have been put on mute. I actually, sorry, I went over my assigned slides. So I think somebody else was supposed to be picking up. I must have infringed on someone else's territory. So I will yield the work, but thanks very much for this opportunity. I will stay on the webinar through the end in case there are any other questions, and over to the next presenter. Thanks.
Oops. Okay, somebody keeps muting when I unmute. I think we are pressing the same buttons at the same time. I hope you can all see me. So thank you, Anne, for your rich presentation regarding the PMNCH active efforts, especially those involving the campaigns and outreach functions at the global level. And I've not gotten a response, but can everybody see me and hear me?
Yes, we can hear you, but this slide needs to be the next one because you're presenting on partner engagement, right? Yeah.
Yes,
okay.
which
Over
is slide number 12. Are we there yet?
Yeah, we're on slide 11, which is partner engagement. We're correct now.
Okay.
Over to
So
you.
I will provide an update on PMNCH partner engagement efforts in 2022-23 and how they have focused on grass tops as well, of course, as grassroots engagement. So first of all, developing a head of state and government champion network, that is the Global Leaders Network, which is chaired by His Excellency President Cyril Ramaphosa. His Excellency President Macky Sall has agreed to join the network, and positive responses are currently expected from Bangladesh and Tanzania that have expressed verbally that they want to join, but need to confirm this in writing. Bilateral meetings have been held with more than 30 ministers on the lines of key opportunities such as the World Health Assembly, the regional committee meetings, and other global policy meetings to understand national women, children, and adolescent health priorities in an effort for the partnership to engage and support through its partners in these countries. We have also been engaging parliaments through the IPU assemblies, including bilateral meetings with 20 national speakers of parliament to better understand capacity building needs of parliamentarians regarding women, children, and adolescent health issues, and how the partnership can support them in this regard, as well as the path to an IPU resolution on adolescent well-being. We have been focusing on laying the groundwork for multi-stakeholder collaborative advocacy action plans that engage all community members in an inclusive analysis, planning and action effort, which is supported by national digital advocacy hubs. These have been activated in 5 priority countries by June this year. And we are more to follow this quarter and next quarter of 2023 and well into 2024. In terms of the digital advocacy hubs, these were launched this year with priority for constituency hubs, GFA hubs, and country level hubs that will support advocacy and accountability with partner countries. I would now like to hand over to Hafsa to provide an update on the digital advocacy hubs. Over to you, Hafsa.
Thank you very much, Joy. Hello, everyone. My name is Hafsa. I'm the Vice Chair under 30 for the Governance and Ethics Committee and I'm the Secretary of the Adolescent and Youth Constituency. So if you look at this particular slide, you can see hubs were developed in 2021 and were rolled out in 2022 with different phases. So far we have 23 hubs launched with 23 email campaigns reaching our members with over 609 active users and 473 total posts and 134 app downloads. We also have recorded a lot of opportunities and learnings with the hubs, and there's a lot of active participation of members, which has sort of revealed the need for this platform to continuously develop. So actually, with the launch of thematic hubs and other specific hubs for committees and working groups, we are aiming to engage the whole membership and make sure all PMNCH members have access to our advocacy resources and networks. Next slide, please. So here you can actually see PMNCH was ranked as a very high performer in the 2023 Global Health 50/50 report, and not just in 2023, but a consistent high performer due to the performance in the last 4 years. So I think something we can all be very happy about. Next slide, please. Right. So in terms of the governance updates, the governance reform, light touch assessment, and the good governance and good management were actually key pieces of work led by external consultants, which focused on actually strengthening the governance and management of PMNCH. So when these works were identified as key areas of course correction and look at how you can strengthen PMNCH processes to focus on making it an agile organization. So the slide presented shows the recommendations from the light touch assessment and the good governance that was actually endorsed by the GEC and the executive committee in June and July 2023. So the governance and ethics committee together with the standing committees and the working groups will now work towards implementing these recommendations. Next slide, please. So here actually one of the key recommendations is to balance the servicing levels actually provided by the Secretariat and looking at how we can enable partners to engage with PMNCH in a more meaningful way. So as a result, recommendations of the light touch assessment are all anchored around streamlining structures and making sure the governance infrastructure, we make sure that it is more leaner and basically reducing the number of meetings and reducing the number of support needed from the Secretariat. This also shows the targets that we will be working in the coming year. Next slide, please. So this is actually a snapshot of the PMNCH membership growth, where you can see there has been an increase by 37.8%. Currently, we have 1,431 members, with the largest constituency being the NGO constituency, followed by the ART and the AY constituency. I would now like to pass to Mike, the Vice Chair of the Knowledge and Evidence Working Group. Thank you.
Thank you very much. Good afternoon, colleagues of the Executive Committee. This is Mike Mbizo. I'm Vice Chair and I'm standing in for our Chair, Mark. I serve as one of the core Vice Chairs, including chairing the Academic Research and Training constituency. And so I'd like to start by making a very positive observation in that we have had a fairly incredible number of knowledge products that have emanated from the partnership, coming from various groups, but these knowledge products do represent an array of areas for adaptation, including at policy level, at programmatic level, as well as evidence-based advocacy levels. I think it's worth noting that up to 13 digital audio-visual knowledge translation materials have been produced, and some of these have been alluded to. There have also been up to 83 talking points and messaging frameworks, including events and champion mobilization. I think the extent of reach and the extent of being responsive and ensuring that these advocates products or these knowledge products are tailored according to the needs out there became very pertinent and obvious in terms of trying to follow what the partnership has been doing. We've also seen up to 21 end media products that have been developed that look at lived experiences across constituencies, and up to 55 flagship knowledge reports and briefs. So what I'll try to highlight in this one slide is really just a tip of the iceberg in terms of some of the knowledge products. Some of these are fairly cross-cutting. For instance, the scoping review on investing in WCA, Case for More and Better Investments for WCAH across the continuum of care. I think this is a product that responds very much to the issues that affect women, children, adolescents in terms of the need and the call for investment. The G40 policy brief on maternal, newborn, child, and adolescent health and well-being, a critical agenda for the G20. I think it's worth noting that these products look at how to be responsive at the highest level, highest policy level, as well as being relevant at the grassroots, as well as implementation level. So that wave that moves from targeting the policy makers at the highest level, and then enabling the grassroots to demand the action required to make a change. We've also had papers on the impact of climate change. These were shared with the board, including one on the adaptation and mitigation, the climate change one on the adaptation and mitigation, but also on the intersectorial financing, looking at the intersection of financing as well as economies, just to ensure that there is informed response in terms of some of the cost benefits of the investments that are being made. We had the launch of the Born to Sin Decade of Action on Preterm Birth at the IMNHC meeting in Cape Town that drew quite a large audience in May this year. And the potential audience reach for this product has been estimated at 3.4 billion worldwide. And this is really a single largest reach recorded for any of the partnerships campaigns over the past 3 years. It's really good to see that the campaigns, the multi-level campaigns, have had a target that covers the full breadth and the width of the potential users. Maternal and newborn health key advocacy messages, which have been developed by ENAP, EPPMM Advocacy and Accountability Working Group. These are very active working groups and have come up with innovative messages for advocacy. The high-level champion-led media op-eds, looking at the high burden of maternal mortality in the Telegraph, which had Honorable Helen Clark and Dr. Tedros, the Director General of WHO, as being amongst those being cited for the work that's taking place. Maternal and Newborn Health in Africa, which has been published by Thomson Reuters and signed by His Excellency President Ramaphosa, President of South Africa. The last product in the few minutes I have, which I would like to share, is really the advocacy brief on sexual and reproductive health and rights in the context of universal health coverage. This is a product I've really liked and I have shared with colleagues within academic institutions and other institutions, in that it brings to the context, to the fore, the whole essence of SRH in the context of universal health coverage. And partners are making reference to this product, and we think that it's a live document that can continue to be used and to be of relevance. Madam Chair, I end here, and I would like to introduce the next, which is a video by Jennifer, if that's ready for showing. Or is it a presentation? Is
Good morning.
Yes.
Okay.
Good afternoon. Good evening, everybody. I'm very pleased to be with you today to present to you a summary of the 2022 to 2023 highlights in accountability for action. The accountability efforts over the 2022 to 2023 time period have been focused on aligning and strengthening advocacy in support of the identification of both progress and gaps, and to strengthen commitment mobilization, and implementation at country, regional, and global levels. In regards to progress reporting, as part of an effort to consolidate and streamline reporting on the Every Woman, Every Child Global Strategy on Women's, Children's, and Adolescents' Health, we have developed an alternating cycle with WHO so that in 1 year there is a progress report that is prepared by partners, and then in the alternating year there is a report that is led by WHO and launched at the WHO. 2022 marked a year of a partnership report, and this involved PMNCH coordinating with WHO, UNICEF, UNFPA, and Countdown to 2030 to prepare the Global Strategy Progress Report launched at the World Health Summit in October of 2022, which was also importantly supported by the UN Secretary General. This report has been broadly used and has achieved a potential estimated media reach of around 860 million viewers. Moving on to the next bucket area on capacity building activities, PMNCH, in collaboration with partners on the latest country profiles and other data tools to improve progress on women, children, and adolescent health, has done a series of webinars and other launch events, including the launch of the latest round of the Countdown to 2030 profiles that include national equity and early childhood development profiles, and then also supporting the UN high-level meeting on universal health coverage and knowledge sharing for the national voluntary reviews organized by UNDESA. PMNCH, through the Accountability Working Group, had also prepared a series of thematic accountability blogs that were linked to key PMNCH flagship events or key moments. Regarding the compendium on women, children, and adolescent commitments, PMNCH is undertaking a mapping of women, children, and adolescent health commitments at global, regional, and country levels, and is outlining accountability mechanisms available to multi-stakeholder platforms in advancing the implementation of these commitments in PMNCH priority countries. Lastly, the accountability portal. PMNCH is actively working to bring together accountability resources, evidence, guidance materials, briefs, all in one place in this portal that will facilitate peer-to-peer learning and capacity strengthening for partners so that they are able to use all of these tools in their accountability and advocacy efforts. Thank you very much.
Thank you for that, Jennifer. And we will then now go to the next slide, which dear PMNCH partners, this is a summary slides of our results. And you will recall that PMNCH does not do silo of our knowledge or our partner engagement or campaigns. This is all very strategically linked to each other. And the committee chairs that have presented to you and the working group chairs that have presented to you have been charged to look at not more is better, but what is clever, smart action to do that is linked between these advocacy approaches and arms. So there was a concerted effort to not do very many knowledge products. We have been working very smartly in deciding what PMNCH's added value is and what products, advocacy briefs or documents to develop that our partners and ourselves can take and drive more accountability and advocacy. This has also resulted in, as you will see, the numbers have been highlighted already, but the partner engagement has included capacitating our partners to do more themselves, but to do better together in strengthening coalitions, networks, as well as capacitating partners in the knowledge and also in advocacy. So here you will see that we have provided to you a summary of the 2-year work plan. And the parenthesis is what we have then achieved in this last 6 months, in 6 months in 2023. So you will see that we had 321,000 visitors to our website. We also have the visitors to the 1.8 campaign. We have also enhanced our membership by 37.8%. We have also then another feature of our advocacy is campaigns and events. And here too, the strategic advocacy committee decided that we shouldn't have more events, but we should have smarter events in really delivering on the added value of PMNCH. So here there is a connectivity of the network of global leaders, the events, and also reaching out through our campaigns. And you will see then that the media hits and cumulative estimated potential reach of 11 billion, of which 4.7 billion has happened in 2023. 37 million people have been reached in social media through our channels, and also the increases in our different platforms, which we have provided to you here. We have also, as agreed by the board and also by the committees and working groups, support partners in their efforts. So this is some campaigns and events that we organize, but also mostly we support partners. All of this has been mobilized in the heart of our results framework, which is to provide follow-up to commitments or mobilize for new commitments, as has been agreed, and also to rally for 5 new regional or global action plans or commitments that we will then deliver on. So all of this in the spirit of women, children, and adolescent health. And this is how our advocacy is carefully designed in order to be strategic. Next slide is the Secretariat update. I'm delighted to present on behalf of the Secretariat, which has been through several surveys. He concluded that we are in line with your expectations and with your needs. The response from the light touch assessment was that the partners feel very well supported by a highly qualified secretariat. And however, that some of the areas of challenge was to reducing governance structures and or meeting so that we can enhance our productivity and be more effective in delivering the work plan and our strategy. So an effort of streamlining. The effort was also intended to reduce workload, both from your side, but also not the least on our side. So better engagement, less workload for yourselves and then for ourselves. That was really the key message from the light touch assessment. The MIND governance, good governance and good management was the overall findings and conclusions from a 75% response rate from the Secretariat showed that out of the 50 variables on good management features, we scored 0 in the red zone, 9 in the yellow, and 41 in the green, which was then concluded by the consultants to be extremely positive. Secretariat will maintain positive green areas, and this is all of the areas that we were in green, but work on improving the yellow to get them into the green, but also more related to also outliers. So the areas that were identified for better improvement was role clarity, more effective organizational communication across teams, and also greater prioritization to navigate workload volume. We've had two staff retreats, one in December 2022 and the other in June 23, to strengthen secretariat planning and operations. And here, where we have developed agreement approaches to increasing partner centricity and also greater governance, efficiency, and outputs, including through digitalization. So how can we punch over our weight in meeting your needs and enabling the strategic vision of PMNCH being the most effective partner alliance that really can advocate strongly for women, children, adolescent health. So the second point was to prioritize staff well-being by increasing staffing levels, which we have done, and establishing no meeting times. And this has been, I thought this was not going to work, but this has absolutely worked. Carving out time where then individuals get more time to work and to focus. And then increasing clarity on team and in individual roles and responsibilities. Staffing levels have increased by 28% since 2020, and currently 25. We have a staff of 25 staffing consultants, of which 31% are under 30 years old. So we have very much taken to heart the MAIE, which is the Meaningful Adolescent Youth Engagement, and increased the profile of young people in our secretariat too. Last is the staff organogram is being revised to streamline further. Instead of 5 teams, we'll consolidate into 3 teams with which will look at career path being explicit in planning, and our organogram to be further updated through consultations in 2023 into then the last years of the strategy, which is 24 and 25. So this is very much on our side, looking at the ways there has become much more digitalization, both in communication form as well as platform. So this has been a very important feature. Last slide. So, dear PMNCH members, we have presented to you this style, which was thought of not only limiting it to the executive committee, but also opening it to all of the members, and for transparency, and also getting then a better engagement in the work plan and the work operations of PMNCH. So what will happen now is you will have the opportunity of asking questions, or please feel free to use the chat, and we will then absolutely get back to any queries or any comments. We will also then, the executive committee will, after this webinar, get an updated version from the committees, which have been represented here by their chairs, and presented the work plan progress report to you for the EC's final approval. So progress report and budget implementation will then be sent to the EC for their approval. So let me stop there and then open it up to any questions or comments. So I do not see any hands, but I do see some comments in the chat. And indeed, we are getting the results in from the Global Forum for Adolescent and all of the 1.8 campaign, and this has now what young people want, as you will see, surpassed 1 million, which was the target. It is at present 1.155 million, and we are also past our participants of 5,000 for the Global Forum. And we're getting very close to and around the 100 mark of national events. I have to tell you that the national events are very moving. They are both from the academia academic side, as well as community engagement, community hearings or participation. And this is absolutely the model that the Partners Forum has been chosen. Earlier, we had conferences that every fourth year we had a conference that lucky 5,000 got included and were a part of. We had always in PMNCH and a goal of having 20 to 25% young people. So that has been always our mark. But this model this year was to make the global event virtual and rather then take the events to the community and have it led by our partners in their settings and make the knowledge framework, the monitoring framework, and the investment case a real issue that was owned by the young people as well, as well as the community. So this is a model that has been in the making, and it is the first time that we have done it in this way. We're very excited about this because I think taking it to the citizen hearings or the engagement at communities and parliamentarian hearings and media in countries has maybe a greater effect in long term. So hopefully this will not stop. It will continue with our 1.8 campaign. Okay, now I think there is a hand, and no, there is a new person that is coming in. If you have any questions after thinking and looking at this presentation, presentation will be available on our website. So we will make it known that it is possible to view this, even though it was for our members that were not able to meet up today. So this is really what we have for you. I will then, since I don't see any hands and questions, I will ask any of the, here we have a question. A hand is raised. So Sena, please may I welcome you with your comment or question.
Hi, Helga. Hi, everyone. Thanks so much for your work. I work in the Foreign Commonwealth and Development Office in the UK. I hope you can hear me. I was just wondering if you could give any update on the country level commitments, any progress so far. You've done so much work, and I think someone else has also added a question about how this translates to change at a country level. It'd be great if you could give any update on that, please. Thanks.
So let's give you 2 updates on this, more deep dive. Well, that's Anshu Mohan to come in for the adolescent well-being commitments and give an update there. But there is also the update that Joy presented of the coordinating advocacy action plans that are then taking place in 10 to 13 countries, which focus on the progress on implementation of existing commitments, and that is still work in progress, but we will see. We have also been simultaneously in dialogue with 27 ministers and including heads of state that talking about commitments for women, children, and adolescent health. The other thing I would like to share with you all is that Somalia on behalf of the EMRO countries, put forth at the last World Health Assembly a suggestion of having a maternal newborn child health resolution, WHA resolution. This is something that we are also following up to ensure that there is indeed a resolution during WHA on women, children, adolescent health. So this is something that we would like to flag and use our partners for change in influencing. But Anshu, Mohan, can I please ask you to come in on the commitments for the adolescent well-being?
Thank you very much, Helga, and greetings, colleagues. Very quickly on the adolescent wellbeing commitments, we are fresh from the GA, and we have heard from 10 member states with different levels of support for adolescent wellbeing, and across the spectrum of countries. So and these are statements of support coming out in for the adolescent wellbeing agenda, and we hope to hear from 6 to 7 more countries by the time we get to the GFA. So all in all, we are looking at, at this point in time, we are looking at commitment from around 17 to 18 countries, very specific to adolescent well-being, which includes the adolescent well-being domains, address different aspects of adolescent well-being, and most of them are policy commitments. And then we are still putting them in through the system, processing them, and starting the analysis of these commitments, and to be announced at the Global Forum as a set piece during the closing plenary of the GFA. So as Helga said before, that this is the GFA is a starting point of a conversation, and we hope that the commitment drive continues beyond 2023 to get more momentum and support from member states in prioritizing adolescent well-being as their agenda. And as most of you know, that this is a cross-sectoral initiative. So commitments have come across different sectors, touching on health and well-being, touching on nutrition, education, protection, for young people, for adolescents, and of course our primary area, our anchor health, and most of the commitments also touch upon SRHR and bodily autonomy. We haven't undertaken a detailed analysis yet. We are starting the process leading up to the GFA, and then hope to have other commitments come in early October or before the GFA. But the bottom line is that this is an ongoing process, and we will see commitments rolling in throughout 2023 and going well into 2024, for which your support would be required. I see colleagues who were there at the GA event, John in particular. So John, if you would like to come in and complement what I have said, that'll be most appreciated. Thanks, Helga, and John, if you'd like to come in.
Sure, Anshu, thank you. And hi, everybody. John Klein with the Healthcare Professional Association constituency and also on the Global Forum Coordinating Committee. So as Anshu has said, the commitments are beginning to come in. It is the start. I would just note there's a youth-led agenda for adolescent health and well-being that has been drafted over the last week or two now, that is just about to get circulated out to all of the constituency chairs for comment, and then we'll very quickly go to the executive committee for approval, and it will be part of the closing session for the forum, which will also be where many of the substantive commitments will be profiled, so that if you have an hour to give to adolescent health and well-being in the next month, I would urge people to consider blocking out that time at the closing session of the forum, where both that agenda for PMNCH moving forward for adolescent health and well-being, and also many of the country and civil society commitments will be profiled in the close. That's really all I can add to what Anshu already said. The program is live and online. It's been the site has been posted into the chat, and I know all of the session individual leads are frantically working to have their run ready to go. Many of the sessions will be interactive. We're expecting a very large youth audience, and we hope that you'll encourage all of your networks to register and participate as well. back over to Anshul, to Helga.
Yeah, thank you for that, John. And I'm sure there's come another question about how we are taking in the what young people want and engaging more with underrepresented youth, thinking specifically about the digital divide. Can you say a little bit about that, please?
Yes, absolutely, Helga. So what young people want, I saw, my apologies, I was a little late into the meeting. What young people want is just cross the 1.15 million, bordering on 1.2 million responses. And we were very intentional that the digital divide does not topple this agenda. So we went a multi-pronged approach. This was through a WhatsApp, a chatbot, and the second was through mobilization and the analog methods of actually collecting testimony on pen and paper, and which were fed into a system where these were analyzed against the various key questions, open-ended questions. So our efforts were to ensure that we were working with young people who don't have access to technology, and for that we used our partners based in countries who are community-based, who have boots on the ground. So this is what has come out through the What Young People Want is an amalgamation and a spectrum of various stratas of the population group. Thank you, Helga, and happy to answer any more questions. While I'm still speaking, we just, and thank you, John, for that shout out. We have more than 5,000 registrations for the Global Forum for Adolescents. So once again, making the plug to please promote in your networks. The more people we have engaged in this conversation, the more we will be able to promote this conversation and thus activate impact at the country level. So multi-pronged approach of conversations at the global, national, regional level, commitments that feed into national program, eventually leading to shift in policy and programs supporting and focusing on this population group. Thanks very much, Helga, and back to you.
Yeah, there is a question about how to get engaged, and that can be a twofold question. One is in the 1.8 campaign. And as you will recall, we had 5 asks, and we had 5 opportunities to get engaged. And please look on our website, and you will find who the contact person and how to get engaged related to that. One is to make known the Global Forum for Adolescents. The other is to spread the survey so that we can get more young people engaged and also hear their voice for what the young people want. And also to organize national forums and what we can offer in the package and guidelines and so forth. So that is all available on our website. And please feel free to use that. We will update that as new knowledge and updated information is made known. So that is important. For the adolescent well-being, please note that there is now consensus over what well-being means, the 5 domains, and what are the interventions related to each one of them, and the monitoring framework. So we hope to get and see more national plans include adolescent well-being, and also national information systems as much as possible to include the ones that are able to be there as indicators. This is really critical. The other thing is the investment case. Very soon we will have the investment case developed both at global as well as national, and that will also include the tools which we will make available so that the partners at country level can take this and implement it at country level. So this is really an ongoing. The Global Forum for Adolescents is not an end. It is a milestone in an important journey that is taken onwards and further with the campaign itself. So please be part of it, own it. This is a global movement, and without you all, it is not going to actually happen or be effective. So that is what I can say. There was a question about what PMNCH is doing in climate change. And this is also included on our website. We have developed monitoring, not a monitoring, an advocacy roadmap, which includes from the board and all of the activities and COP in November, COP 28. So please go to their website and see what are the details. If there's anything you want to contribute, then please get in touch with the focal point and also ourselves. We have also lead partners in this, as we do to all of our deliverables and activities. So this is something that we can also facilitate in creating a dialogue and task team and task force to better engage on these important board priorities. Okay, is there any other? We have provided some answers in the chat and some links, so please feel free to access them for ease of reference and also see a little bit what you want and can do towards this, and please get engaged. Just one last thing about governance. Since our governance and committee started, we are reaching the three-year milestone for many of our members, as well as leadership roles. And so we will, in the beginning of 2024, come out with more information as it relates to what structures and where and how to then nominate yourself or your organization to take a role in these committees and working groups. However, as you saw from Isa's presentation about governance, the light touch assessment has resulted in effectivizing the structures. So we will come back in 2024 with new updates, as well as also the process related to nominations. At any given point, approximately 120 to 140 are active members within their structure, which is 10% of the membership. However, with the advocacy hubs, digital advocacy hubs, I think this mechanism will facilitate that even more can get better or quicker informed and also engaged. So this is something that we are looking very much forward to getting these up and running. However, they are only as good as the content in them. So you have to all help in getting the content and the objective of engagement clear and very powerful, because it is the mechanism itself will only facilitate the content. So both are needed, and please help all of you with that. Okay. We will also, I think, try to, because the governance structures are tightening, it will enable us to look at how the constituencies can better and more effective feed into the work of the committees and working groups. So I am hopeful that next year that we will focus more on exactly that. Okay. Anything else? We are over. So if you have any more questions, I would like to take this opportunity on behalf of Helen, our board chair, to thank all of your participation in this and engagement, and also your results. This is really critical and important. Then I would also like to then take this opportunity to thank the committees, committee members and chairs and leaderships for all their work, which is actually the stewards of PMNCH as work plan. Yeah, EC members, thank you for this, and we will be sending together with an update on what happened today and some of the questions to the EC for their approval. So thank you all very much, and from the behalf of my secretariat, which I am always extremely thankful for all their work and efforts, thank you from us. Now, Nella, do you want to say something, ask something quickly?
No, so sorry, I was trying to react and say thank you so much for hosting this event.
Thank
Sorry
you.
about that.
No problem. No problem. Okay. Thank you, everyone. Thank you from our side, from the secretariat. Bye-bye now.
Bye-bye now.
Thank you.
Thank you. Bye-bye.